I am Hazel Cheeseman. I'm Deputy Chief Executive of ASH, and welcome to this event with the NHS, the Smoke-Free NHS Network. We are going to be talking about vaping today, and this is our agenda. So we're delighted to be joined by Allan Gregory from OHID. Some of you may already have heard Allan talk on the webinar which OHID held a few weeks ago on their new vaping portal. So this is just a bit of an update for those of you who weren't able to go, and a reminder for those who were there. We are going to share some of the resources from that webinar, which will go into the new procurement portal in some more detail. And then we will hear some practical examples about how e-cigarettes are being used on the ground in different settings. So from Caitlin from the Northeast, from Matt in Greater Manchester, and then Richard in Northamptonshire. Then we know that one of the benefits of having these sorts of events and webinars is that lots of you can come, but one of the downsides is that it doesn't necessarily allow you to talk to each other. So today we are on Zoom for the first time, and we're going to have some breakout rooms and allow some time for discussion. But we'll come to that later. And then we will all come back together for a final panel discussion and closing remarks. Right, before we go into the detail of the event, we've got a little bit of housekeeping, and I've also got a few slides. So it's being recorded. We will circulate a recording of the event and the slides in due course, and also be available on our website. Ask everybody to keep themselves muted unless they're presenting, and we will mute you if you breach that rule. We'll also really encourage, these events are always best when they're interactive and people are posting lots in the chat. I'm less familiar with Zoom, and I assume that you can find your way around the screen to find where you enter information into the chat. But please do so, and people are going to be keeping an eye on that for the Q&A session as well. And if you've got any problems, then email our admin email address and we'll get back to you. Probably best to do that rather than put it into the chat, because there might be quite a lot of other information in the chat. Okay, so let's move on to a few sort of scene setting slides. So I've just got to move this so that I can read the slides properly. Here we go. So the purpose of today is very much to reflect on the kind of how we use e-cigarettes in our services to support smokers to stop, and to think through what some of the opportunities and challenges are of using these products. As I said, we've got some really great case studies that will help us to kind of think through some of those issues from different services around the country. And we're going to be coming back in the future to look at some of those settings that might have particular issues around mental health and maternity settings. And so the purpose of today is very much to focus on adults. Yeah, so it's okay, John, you can move on to the next slide. Just want to give a bit of context for adults as well. And I'm going to be speaking about, on the next two slides, or two or three slides, I'm going to be speaking about data which is embargoed until tomorrow. So please don't screenshot this and tweet it, or if you do screenshot it, wait until tomorrow to tweet it. So this is new data from the ASH surveys, where we've been tracking vaping behaviour among adults and young people. But before I go into that data, just to reflect on what the kind of policy position is. So we've got these really brilliant evidence reviews which OHID have commissioned over time from King's. The most recent one, which was massive, comprehensive, 1,000-page document looking at the harms and the evidence around harms from vaping, from the vast body of evidence that has now been accumulating over the last decade. And the conclusion of that's pretty clear from that very, very vast document. So in the short and medium term, vaping poses a small fraction of the risks of smoking. But it's important to remember that vaping is not risk-free, particularly for people that have never smoked. And so our approach to vaping at ASH and across the public health community has always been one of balance, one that really recognises the benefits of getting adult smokers to switch to vaping, whilst also not wanting to see those that don't smoke using these products, and needing to calibrate our policy to meet those objectives. And we've been reassured in recent years that this is a good strategy in terms of adult smokers, because we have really some robust evidence now that e-cigarettes are effective at helping smokers to stop, and more effective than the mainstream medication available on the market at the moment, nicotine replacement therapy. So what do we know about adults that are smoking? So we have around 9% now, as of our 2023 data, of adults that are kind of current vapers. But we do have a group of smokers in the population who've never tried an e-cigarette. So 27% of smokers have not tried one. Then we've got around, but it's very rare among adults that have never smoked. It's unusual to find vapers. So just move on to the next slide, because the kind of big findings that we'll be publishing relate to 11 to 17-year-olds. So there's a lot of that you cannot have missed the media coverage around youth vaping over the last 12 to 18 months. It's been a very big news story, and there's really big concern, these headlines around youth epidemic, etc., of vaping. So it's really important one where obviously we're concerned about young people using these products, but it's important to go back to what the evidence is telling us. And although it's not core to this conversation today, it's obviously the environment in which we're all working in. So there has been growth in experimentation, trying e-cigarettes once or twice between 2022 and 2023. And that's a cause of concern for us. We definitely do not want to see experimentation in this population. So it's around 12% of young people say they've tried an e-cigarette once or twice. Overall, about 20% of young people say, 11 to 17-year-olds say they have now tried an e-cigarette. But it's important to recognise that current use from 2022 to 2023 hasn't seen a statistically significant increase. It's still higher than we would like it to be, but it hasn't grown statistically significantly. Smoking rates have also decreased, but that's not, they certainly haven't gone up. Our survey is not powered enough to detect whether that's statistically significant drop. Most of these young people are using disposable e-cigarettes. They are buying them from shops, and the most common source is newsagents. And of course, it's an offence to sell products under the age of 18. So that's just to give you a flavour of this data that's coming out tomorrow. As I say, it's embargoed. Please don't tweet about it until tomorrow. Hopefully it will be in your newspapers and on the radio tomorrow morning. And those of you who are interested in more content around young people, our resources for young people are there. So let's get into the main body of the webinar. So we're all here today because there's a new portal that OHID have launched around vaping products. We know that the government has announced this new swap to stop scheme. We'll all need to get back together when the government is clearer about how they'll be delivering that, so that we can talk a bit more about that. And we've got a call for evidence around youth vaping. Again, we really want to get people back together and to have a specific event on youth vaping in the future. We're going to park that issue largely for today. And as I say, the focus of today is about how do we pragmatically use these products in our services. So without any further ado, I think we are moving on to our mentee. Oh, I forgot about that, even though I'll be given detailed notes. So if I could get you all to go to this mentee website, www.mentee.co, and enter the code. You can also use that QR code if you've got your phone handy. And we've got a question that we're going to put to you to try and understand a bit more about where everybody is at the moment. So someone's going to share that up on the screen now. Hopefully you're all, we pop it in the chat as well, somebody, to make sure that people can still get the link and the instructions are there. So I can see lots and lots of thumbs up, which I guess means people are, loads of you. Right, should we start having a look at some of these responses then? So what we wanted to know is, what is your organisation's current approach to the use of e-cigarettes for smoking cessation? And you had a couple of different options that you could hit there. So half of us.
Sorry, hello. Would you mind posting that again?
Oh, I don't know quite what happened there. Somebody joined us. Okay, so it's obviously it's live data, so difficult to pick a hard figure, but it looks like around half are providing advice to service users, but not necessarily products. We've got a third of people who are providing them directly or facilitate access to use. And then there's another sort of 20-ish% who aren't really doing anything in particular, and a small group who aren't sure. This is great. Wonderful, wonderful to see how that's breaking out around the country, or at least in terms of the people who are on the webinar this afternoon. Should we give you another few minutes to just finish doing that? And then I think this is great for us to see where people are coming from. So we've got a majority of areas who are taking some kind of proactive stance around facilitating access to e-cigarettes. A lot of that is around advice, but there's also a really significant group of people, at least on this webinar, who are directly providing access. And clearly the portal that OHID have opened is hopefully going to facilitate more of that. So should we close that Menti now, John, and hand back over to Allan to take us through the portal? And if I can ask those of you that are not speaking to turn your cameras off, that'd be great. Over to you, Allan.
Thank you. One, I hope you can hear me and see me. Is that okay?
I can hear and see you.
Excellent. Thank you very much, everybody. So today, let's set the scene. Many local authorities and NHS providers, they've been procuring vapes as an integral part of their quit intervention service offers. They've been doing it either directly with vape suppliers, just shown by your Menti there, or they've been doing it not only with vape suppliers directly, but they're maybe doing it also in partnership with local vape stores as well. So organisations are successfully navigating all the standard local authority and NHS procurement processes. But within those established processes, there's also an option to use procurement frameworks and to take advantage of the associated benefits that they provide when it comes to contract awarding and contract management as well. So this presentation is going to give you a brief introduction to the new vaping catalogue within a procurement framework from our partners at Crown Commercial Services. So thanks to colleagues from them as well. Next slide. Next slide, please, John. That's it. Thank you. Okay, so some background for you. So it's probably about a couple of years ago, we sort of tried to do a bit of a stock take where we were with vaping and vaping within stop smoking services and supporting people to quit using vapes. So stop smoking services in particular were able to point to, and others, we were all able to point to a number of reports and guidance and resources, all of which stated that vapes should be an option available to all people who want to quit smoking. And we were being faced with a number of questions though. So on the ground, people were saying, what products do we choose? What products have been used in trials? What criteria should we be using? Which ones should we be selecting? A big question about how do we protect services from the tobacco industry vested interests as well. Lots of questions around what flavours and strengths should be appropriate. What products comply with MHRA standards? Should we be giving people vouchers or direct supply? And can we work with local vape shops? So lots and lots of questions in the system. But and there was lots of answers in the system, especially from within the system itself as well. But a recurring barrier that kept getting flagged up was how do you actually go about procuring vape starter kits? And that was seen as we maybe get some political support, we're clear on the evidence, we're all aligned, but then how do we actually get it over the line and actually start procuring them as well? Next slide. So the use of vapes in stop smoking service offers presented an opportunity to increase quitting amongst the most disadvantaged smokers. So one of the first things we did was we worked with NCSCT to produce some procurement guidance, which has been recently updated. So if you're not familiar with that procurement guidance, I would recommend you take that as your first takeaway action from today. So have a quick read of that. Even if you are supplying vapes successfully in your service, by all means, read that. It gives a lot of background and answers a lot of questions in there. But then we moved on to and we engaged Crown Commercial Services to develop a procurement solution for vapes. So this would be an approved supply chain, which ticks all the boxes in terms of tendering processes, etc. So, and this is all for public sector organisations. Next slide, please. And to actually develop that, there was quite a big series of market engagement that we did. Many of you on the call today may have been involved in this at certain stages as well. So we did some insights gathering. We spoke to existing services who are offering vape supported quit interventions. We spoke to the vendors vendors being the vape suppliers who are also working within the public sector, supporting those services. So we spoke to the vendors. What are you currently offering? What's working? What's your experience? And we also spoke to the services. Then we shared some drafts of the platform to potential customers and asked them, does this fit the purpose? Does this work for you? And we tested that with the vendors as well, saying, vendors, would you be able to work this way? And what we've done is done a little bit of refining and testing, and we've been then able to successfully sort of launch that from the 1st of April. Next slide. So what does it look like? What is the solution we've come up with? What does it look like? Okay, well, the framework provides, we've come up with a framework that provides a compliant access to let's call it an initial product portfolio of a new category of vaping products. And first thing to bear in mind is that this is within an existing procurement framework. So there's a procurement framework that already exists. So many NHS trusts, many local authorities already sign up to this framework. The framework is called a Tau Spend Solution Framework. It's got a nice little code name there, RM6202. So that's something that your procurement teams in particular would need to know about. And you may want to be quoting that in your business cases as well. But basically what this framework does, it's got a new catalogue of products on there. And this catalogue of products enables you to sort of select vapes, but also work with vape suppliers directly as well. And the key features really is, the big one is around compliance. I say it's compliant with a lot of contracting rules under the public sector terms. So what it means is once you've signed up to this framework, there's no need for any additional tenders or quotes from individual vape suppliers on your behalf, because the framework supplier does that all for you. They've done all that hard work for you. So once you've signed up to the framework, you can enter into a call-off contract with the supplier. And yeah, depending on your individual requirements, there's 2 of them. I'll go into more detail about that in a moment. You can choose which one you want to go into, but you go into a contract with them, which is at no cost, no commitment to actually sign up and use the frameworks. So it's a bit of a no-brainer. You can go in and explore them. You can actually have a look and see what's on there as well. What's key to note is that all the vape suppliers and vendors are required to declare any conflicts of interest. Now, what that means is that if there are any conflicts of interest, such as a interest from the tobacco industry, if the vendor is a tobacco industry owned or associated, or whether the products that the vendor supply may be tied to tobacco industry, it's clearly identifiable, so you can see. But you can also filter those out, for example. So if you've got a very clear policy locally where you don't want to look at those, or you want to identify the different quotes that can come in, you want to identify which ones are tobacco industry and which ones aren't, you can clearly identify that, and you can filter those as well. It also gives you this discrete catalogue of vaping products as well. So what sort of products are on there? So we've listened to services and we listened to the vendors. And what we've got on there is, I would call it a sample product mix on there. So I'll show you again in a moment. It's a bit like an Amazon marketplace, really. You can see all these different products, and the products on there, they've come, say it's a discrete catalogue, and the products will grow over time. But for now, it's an example of the sort of products that public sector hospitals and local authorities, stop smoking services are using. So you'll find different range of products on there, such as closed systems, open systems, single-use systems, a range of flavors and strengths. But you'll also find that they're packaged up into bundles, so you can buy 2-week quit, a 2-week starter pack or 4-week starter pack, and then ongoing e-liquids as well you can purchase. But the products that are actually in there are just an example. What you can do is also speak directly to, within the platform itself, speak directly to the vendors to actually say, this is what our needs are. And this is our particular client group we're trying to work with. What would you recommend? Or you may already have a very particular spec that you want to fulfill. You can share that spec with the providers, and they can say, okay, these are the sort of products we would recommend.
Allan, you've got 1 more minute, sorry.
Okay, I'm going to go through this very, very quickly in that case. Next slide, please. What you need to know is that there are 2 suppliers. So this is one framework, but there are 2 different suppliers. There's one called Unite and one called the OTG group. And you create a contract with them and say no cost. And there's full support from Crown Commercial Services. They will talk you all the way through that process with your procurement teams as well. Next slide. This is the interesting bit. So here are the two providers at the moment. Each of the providers are responsible for what's called onboarding the vendors, so getting the vaping suppliers on board. And you'll see Unite here currently have two providers on there. Two vendors on there, Totally Wicked and Liberty Flights. And the OT group have two vape suppliers on there as well. They also have Totally Wicked, and they have Electronic Tobacconist. Contact details are there. Next slide, please. That just gives you an overview of what it sort of looks like on the site. But the important point here to stress is you can discuss your service requirements directly with the suppliers. You can invite vape suppliers to join the network as well. So at the moment at launch, they each got two suppliers each. Each of the platforms have two suppliers each, but that will grow. And you can invite, if there's a supplier on there that you've worked with and you want to introduce them and bring them onto this platform, you can invite them on there as well. Key messages. This is not a brand new portal or framework, an existing framework which your trust, which your local authority may already be part of, may already be on there. But what is new is this new product category that's now available. You don't have to do it. You can carry on as you are, working directly with vape suppliers, but the framework is seen as a cleaner environment. Also, you've got opportunities there is that you don't then have to keep on retendering, for example. The two platform providers offer, two platform providers, you make a choice which one you want to go with. You could even go with both. The key thing here, all your tendering requirements are pre-met. Therefore, there's no need to obtain further quotes. You can filter and identify clearly any tobacco interests, and all the products have their MHRA numbers linked on them as well. So you can see them straight away that they are all through the onboarding process there. They have all got MHRA notifications. I'm going to pause there, the last page then. If you want any more support or questions, have obviously questions now, but Crown Commercial Services are very happy to walk you through any of this, especially your business cases, and sign off the contracts with one of the platform providers and how to choose a platform provider. You can work directly with the platform suppliers as well. And by all means, you can contact your OHID regional tobacco lead or myself if you need any more further questions. But in essence, they're there to be used. They will organically grow, and it will now respond to the marketplace as to how many more vape suppliers join on there as well.
Brilliant, thanks, Alan. We'll be circulating these slides, and we can circulate the slides from the more detailed length webinar that you held previously. And as Alan says, there's lots of opportunities for more support. And we'll have if you've got questions for Alan, stick them in the chat. We'll come back to them later. Thanks, Alan. I'm now going to move us on to hearing about how we do some of this stuff in practice, and invite Caitlin Barry to join us. Caitlin is the project manager in North East and North Cumbria ICB, and she's going to be talking about how they've been using e-cigarettes within their staff tobacco dependency offer, which I am really keen to hear about. Caitlin, I can't see you, but I'm hoping that we're able to hear you.
Oh, can you hear me?
Yes, I can see you now too. Brilliant. Yeah, off you go, Caitlin.
Oh, perfect. Hi, everybody. Thanks for the introduction, Hazel. Yeah, I'm the project manager for the staff tobacco dependency offer, and I'm going to really quickly whiz through what we've been doing in the North East and North Cumbria. Next slide, please. So just for background on our ICS footprint, so we have over 85,000 NHS Foundation Trust staff across 11 foundation trusts and 13 local authorities, and our smoking prevalence in the North East is just under 15%. Next slide, please. In terms of making the case to support NHS staff to stop smoking, we were invited to apply for funds from NHS England to embed a staff tobacco dependency offer. We are rolling out region-wide the NHS long-term plan. Sorry, just to the previous slide still, thank you. Rolling out the long-term plan region-wide, so this complements that really well, alongside kind of nice guidance that employers should be providing advice and guidance to staff to stop smoking, and giving clear and consistent advice on the use of vapes as a stop smoking aid. Next slide, please. In terms of overcoming barriers, we're really lucky in the North East and North Cumbria that this is building on a long-running work plan and a great foundation of tobacco control and support to stop smoking regionally. What you see in the middle here is the infographic of our regional vision to trigger at least one quit attempt for every smoker per year in the North East. And around on the orange boxes are just some of the ways that we're working towards this. What I'd really like to highlight at this point is the strong clinical and strategic leadership that we have in our region at ICS level. This includes the Tobacco Dependency Task Force, which is an interdisciplinary group that meets regularly and really drives this work forward. We work in really close partnership with directors of public health consultants and tobacco commissioners. And we're really lucky to have the Fresh programme that runs alongside all of this work and has done for a lot of years, leading the way in tobacco control. Next slide, please. So in terms of overcoming barriers and learning kind of specific to introducing a vape offer, so these are just some of the things that we experienced. I haven't got time to go through everything, but part of it was kind of misunderstanding the role that vapes can play in smoking cessation, and the things that were really important for us in getting this message across were things like the NICE guidance and evidence reviews, and also a position statement that was developed by our Treating Tobacco Dependency Task Force in 2017, and that's just been refreshed, and that informs clinicians, people working on the ground, stop smoking services of the role that vapes can play in line with the evidence base. Another learning point was the supply and provision of vapes. Now, with the procurement platform that you've just heard about, I'm sure that is going to be so much easier. But for us, we didn't have that at the time we implemented, and working closely with our trust procurement was really important in costing this up on a 12-week supply, so kind of on a per person basis rather than looking at the product in bulk. Delivery and storage of vapes was also really important. We opted for a refillable, rechargeable device because it was a working age population, and we thought that that would be best kind of environmentally, but also for ease of access and longevity of use. And we were able to work with our supplier to develop a direct to service user postage solution, so people could order on a platform and it's delivered directly to their home address. Next slide, please. So this is just a really brief overview of what the offer is. So really important to identify at this point that we weren't replacing anything that already exists, we were just uplifting it. So this offer is embedded into our local authority provision across the whole region, and the key changes that we made were making nicotine replacement therapy free at the point of access. So typically there was a kind of voucher charge, which was in line with prescription charges. A key enabler for this work was the introduction of the regional vape offer. Like I said before, it's a refillable, rechargeable device with a 12-week supply of liquids and coils. Varying flavours, varying strengths, it really puts the kind of flexibility and control back to the service user. This was alongside behavioural support and our region-wide access to the smoke-free app, which already existed prior to the introduction of this offer. And this is for basically all staff working in foundation trusts across the region. Next slide, please. So in terms of what we've achieved with this offer, so prior to the financial year that's just gone, 22-23, we were able to support over 1,000 staff, but the information you can see here is from the financial year just gone. So we supported over 600 staff with around a 50% quit rate. Really importantly, 75% of those opted to use a vape as part of their quit attempt. And we think that this has been a key enabler for the uptake to the offer. One of our key aims was to target staff working in routine and manual roles, which you can see we had over 13% uptake, and over 50% were from the most deprived deciles. Next slide, please. So key learning. making cessation aids free, whether it's vape or nicotine replacement therapy, really did act as a motivating factor for people to access support. But like I said earlier, 75% of people utilised a vape. This might also have been a kind of as dual therapy, so getting a vape and a patch is an option as well. It's not one or the other. It's just a case of adding to the toolkit that's available to give people a choice. Collaboration was key for us here in the North East and North Cumbria, so working with our local authority partners to embed this into their existing provision. It means we could support more people closer to their home, and they could access trained advisors who could give that behavioural support alongside it. In terms of looking forward, we have funding which originally came from NHS England until the end of September this year. And we will soon commence a service user evaluation with the Applied Research Collaboration here in the North East and North Cumbria. Next slide, please. That's everything from me, just a real whistle stop tour. The slides will be circulated and there's a lot more detail in there, but equally I'm happy for you to email me if you have any specific questions. Thanks, Hazel.
Brilliant. Thanks, Caitlin. That was absolutely fascinating. And we've got a few questions in the chat that we'll come back to at the Q&A. So thank you so much for that. I'm going to move us on to our next speaker. We'll catch up a little bit of time. So delighted to invite Dr. Matt Evison to join us, a clinical lead from Cure, which is the project in Greater Manchester. And Matt's going to talk about the role of vapes in treating tobacco dependency within the NHS project in Greater Manchester. So over to you, Matt.
Thanks very much, and thanks for the invite to speak at such a well-attended webinar. So I'm a chest physician and I'm the clinical lead for the regional tobacco control programme in Greater Manchester, the Make Smoking History programme. Next slide, please. So Hazel did a superb job of the introduction and setting the scene. So I don't need to say too much about this. I guess the only things I'd add to that is the Cochrane review was mentioned, and I only highlight that particularly just because of how the Cochrane process is held in terms of its robust methodology. And for Cochrane to reach a high certainty conclusion is defined as there is unlikely to ever be future evidence that changes that conclusion. So the certainty with which vaping, nicotine vapes help a person to stop smoking cigarettes is now it's no longer a debate. It's completely confirmed by the evidence base, supported by a NICE review. So this is now about translating it into clinical practice to reduce the dreadful harms caused by smoking tobacco. Next slide, please. And I just added this one in as well, this was some of the work I think that really started to cement our thinking around combination treatments and the efficacy and the building efficacy from combining as many treatments as possible. And equally, just to highlight that in our current, as we try and take on the challenge of treating tobacco dependency without the nicotine analog medications, and particularly varenicline, it's highly effective, then vaping is the most effective intervention that we have. And this, again, just reflecting on that, combining vaping with any treatments possible, the more we give, the better things will work out. Next slide, please. So we've got this as a clinician, and looking at the treatment of tobacco dependency within the NHS, then it's become very clear that we have clinical effectiveness, we've got cost effectiveness and returning some of the costs of smoking to those affected by tobacco dependency, and the clear popularity as this is a choice of quit aid or cessation aid. Then we've got a responsibility to embed this as one part of a personalized treatment strategy within tobacco dependency. And I think it's particularly important that the clinical environments in which we work in the NHS, vaping, I think, provides us with this unique opportunity, because there is finally a viable and acceptable alternative to smoking tobacco, which means we can try to deliver finally truly smoke-free NHS grounds. And it's important about the conclusions of the very detailed reviews that Hazel mentioned about risk to bystanders from vapor, which is exceptionally different from the risk to bystanders from tobacco smoke, and particularly side stream effect. I mentioned the combination therapies, and that we are, as clinicians, all about trying to optimize treatment pathways, and it's clear combining treatments increases effectiveness. And so the combination of NRT and vaping together is highly appealing. But to do this, we're going to need senior, both clinical and executive support to implement a strategy like this. And we all have to develop the confidence and the competence in delivering it. And we've got to be standardized in the way that we provide information and access. The next slide, please. So if we think about the treating tobacco dependency within the NHS and in our system, we've got numerous work programs. And our ambition has been to embed a vaping offer within every element of this. And that includes if you're an inpatient, it includes if you're an expecting mother, if you're an NHS staff, if you're attending the targeted lung health check programme, and within our mental health care trusts. And so in all of these areas, we are embedding a vaping offer, but these ones that I've highlighted are particularly where these now have become embedded, and we've got data to share and consider and discuss. The next slide, please. So our journey to date, this is the organisation that I work in, so one of the large organisations within Greater Manchester. And it's been the forerunner for programs like our Cure programme, where it was first embedded before rollout across the rest of Greater Manchester. So we started this journey about 6 years ago. So some reflections on the journey at our trust. Next slide, please. So the inpatient service. So this is now a vaping offer is embedded within our treatment offer. So as an inpatient, and in our opt-out referral model, where every person that smokes and is admitted to hospital is visited by the specialist cure team, one of the offers made during that first consultation is the provision of a vaping device and liquid to use during that admission and beyond. So to try and look at the data, one of our best sources is the NHS England data submission that we have to complete monthly. The latest submission made has been February 2023. So we've looked at our latest submission data. So really, this is as fresh as it gets. So 630 patients referred to our service across our trust in that month, all of which were seen by our cure team. So out of that, 28% accepted and decided as part of their treatment strategy would be using a vaping device and liquid. And this is a time where that the offer has been embedded within the site that I work in, within that trust, Wythenshawe Hospital, and it is in development at the other three. So I think the majority of that uptake is within kind of 1/3 of that site of MFT. But despite that, it's a significant uptake of vaping within the program. And what's really pleasing to see is that actually 2/3 of those, it's in combination with NRT to maximize outcomes, all of which is supported alongside behavior change. And even with just on that data, we're equating that to over 2,000 patients a year being supported with vaping as part of their treatment to maximize the outcomes that Cochrane tells us we're going to get. Next slide. So in terms of the NHS staff offer, very similar to the presentation we've just heard from the North East. So we partnered with the Smoke Free app, and our NHS staff have access to 6 months of premium access to the app, and they have 12 weeks of free NRT and free vaping devices and liquids. And it's a fulfillment offer. So they order the NRT and vaping, and it's through the app, and it's delivered to their door. And we've undertaken or commissioned a deep dive analysis into 150 patients enrolled over a 2-month period that we've posted out carbon monoxide verification kits to get some really high quality, longer term 12-week data outcome. Now, what's interesting is that the uptake of the vapes is very similar to the Northeast program, so very similar to that 70–75%. And this is definitely a younger cohort of NHS staff versus the inpatient cohort. But what we're seeing is significant CO verified both continuous abstinence rates and 7-day point prevalence rates, with some really nice data about what that means for our NHS staff in terms of money saved.
Matt, can I ask you to wrap up in a minute or so?
Yeah. So in the lung health check program, we've got the exact same offer. Our cure staff work out in the community on our lung health check vans, and offer a vaping kit on the day and an opt-out model to any person that attends that lung health check that is a current smoker. And again, this is data over 2022 from a large program where there is a 20% uptake in a vaping kit. Next slide, please. So we are embedding these into NHS programs, and as I said before, this feels like a very unique moment where we could actually deliver a smoke-free NHS grounds because we have this viable alternative. And it feels that it's a moment where a patient that is admitted can access that viable alternative. A staff member can access that viable alternative. And so we have moved to a vaping friendly external hospital grounds so that anybody can vape anywhere on the external grounds, apart from some vape free zones around the main entrances to minimize the social nuisance that vaping can present, with dedicated areas of quit zones where there's some cover, particularly in areas of bad weather. And next slide, please. And these are just some of the examples of the signage and the comms strategy for helping to try and deliver that. Next slide, please. And just some information on vape free zones and quit zones. So it's very clear now that vaping is a central component if we are to deliver the highest level of effectiveness within tobacco dependency treatment. And as a healthcare system, we've got a responsibility to ensure there is access to the most evidence-based treatments. And I think we can demonstrate that uptake is excellent when it is accessible as part of everything, and it will increase the effectiveness because we've got all the evidence behind that. And it is finally a viable and acceptable alternative to tobacco that gives us this opportunity for smoke-free grounds.
Brilliant. Thanks, Matt. That's great. Sorry, I cut you off, but I think you were just saying you were finished. Thank you so much. Again, a really kind of interesting insight into how vaping is sort of facilitating some of our broader objectives. So I'd like to invite Richard Holly to speak. Richard is the tobacco control lead in Northamptonshire, and he's going to talk about how the local authority service is embedding vaping within their offer. Over to you, Richard.
Thank you, Hazel. Much appreciated. So I'm going to be talking about how we implemented e-cigarettes into our local stop smoking services across Northamptonshire. Next slide. So I'll first take you back to 2019 because that is when we were making some big changes to the delivery model in Northamptonshire. So we made the decision to decommission some of the external providers that we used to get quits for us, so GPs, pharmacies. And we used this kind of transitional period to look at other things that we could offer to people in our county, and really try to determine how we could improve quit rates across Northants without increasing costs, make it a more equitable service. So we actually had a history of working with e-cigarette stores locally. So those external providers I mentioned who got quits on our behalf, some of them were e-cigarette stores. I think we had about 7 at any one time in Northants. And it was largely quite successful. So we, at that point, really appreciated the value of e-cigarettes as a way to help people stop smoking. And of course, we had seen really impressive results in our neighbours to the north, so in Leicester and Leicestershire, who at that point had been providing e-cigarettes for some time. So we had good kind of local examples of the efficacy of e-cigarettes as a cessation aid. We were very lucky that our Director of Public Health was really quite pro harm reduction, and she saw the value of e-cigarettes as well. So by the end of 2019, when all of these changes had been looked at and considered, a decision was made to start providing them ourselves. And yes, if you go to the next slide, please. So the first step was obviously securing a provider. So we looked for a provider that had obviously no industry links, TPD compliant, good diversity of flavors and devices, strengths of flavors, etc. But we were also looking for a company that could provide some kind of after sales support. So I mean, myself, I've been interested in this topic for probably over a decade now, but I knew that my team of advisors and stop smoking specialists didn't have a great deal of knowledge. So we really wanted to find a company that could provide that level of training and answer any questions that we found particularly difficult to answer from our clients. So we managed to secure a provider in, well, tail end of kind of 2019. We went with a company called Totally Wicked initially. And then this was rolled out to all of our service users in February of 2020. Next slide. So what exactly do we offer? So currently we work with a company called Dinner Lady. We started working with them in January of this year. So, but the offer hasn't changed between Totally Wicked and Dinner Lady a great deal. So we currently offer the Inokin T18E device, and then which is a pretty basic starter kit, really. There's no difficult power settings or anything of that nature. It's refillable, and we provide the liquids in addition to the device itself. So we also provide 5 coils in addition to the 2 that are provided in the starter kit. And we offer a range of liquids. So we currently offer 4 different flavors. So we have smooth, tobacco, strawberry, macaroon, menthol, and kind of like a mixed fruit, pink berry liquid as well. And they come in 3 different strengths. So we have a 20 milligram salt variant, 10 milligram salt variant, and a 6 milligram freebase variant. So all of this is kind of provided in combination with nicotine replacement therapy as well. So we do give people the chance to combine it with another medically licensed form of nicotine. And next slide. So these are the results of our first 2 years in providing e-cigarettes to our service users. So just over 2,000 people chose to vape with us over the first 2 years, and the success rates, speak for themselves. I think, we weren't expecting them to be quite as high as they were, truthfully, especially the e-cig in combination with NRT, which proved to be really popular and got very high quit rates, higher than those that we had experienced even with varenicline at that time. Next slide. So what were the biggest difficulties to implementing all of this? Well, I think the first one that I should probably mention is the vape stores. So the contract that we had with our e-cigarette stores locally, whilst we were decommissioning pharmacies and GPs, we did want that to continue. We saw the value in that. Not all of the providers were wonderful, but there were a few real gems in there that got very high quit rates and were really engaged. But frustratingly, the ones that performed the best were the ones that were probably most against us providing the vapes ourselves. Some of the feedback was simply, you're going to flood the market with cheap e-cigarettes that we will have to repair and we won't make any money off of. And they wanted us to kind of go down the voucher route. Which was not really something we considered, that kind of feedback from local retailers. And I think looking back, it was quite naive to not consider that, really. But tragically, that contract didn't continue because the ones those arguments didn't want to keep going with it. And as I mentioned, they were the higher performing ones. So the next difficulty would probably be access. How are we actually going to get these devices to people? Initially, we had considered kind of our team of advisors taking them out to clinics and providing them, but there are so many variants of flavors in the devices themselves that that just wasn't practical. So we made the decision to post it all out. So we went down the direct supply route. And we do the same with our NRT. So it makes sense for us, but there are definitely headaches with that as well. So speaking of the direct supply route, so storage, so word to the wise, if you're going to order thousands of pounds worth of any nicotine products, know exactly where you're going to put them. That's really important. I think at one point we had stock floating around in 3 different council buildings that I was having to ship here, there, and everywhere. Thankfully, it's sorted now, but yeah, something that definitely needs to be considered. Next slide. So in summary, vaping and the inclusion of e-cigarettes in our service was part of a much broader set of changes that we were making to how stop smoking support is delivered in Northamptonshire. And there were plenty of, and still are to a certain extent, logistical issues that we needed to get through. But we felt that the direct supply route was suitable for what we were looking to do in Northamptonshire, and is arguably the best way to ensure equity across everybody that uses these services. And yeah, there were excellent results. The quit rate for people that use e-cigarettes is simply much higher than those who just use NRT, and that's been our experience, definitely. And it's much cheaper, which is very important. Obviously, I can't go into the specific details of how much we save, but it is considerable. So yeah, finally, if anybody would like to follow up with me after this to get a bit more detail on how we got to where we are, by all means, get in touch. Thank you.
Thanks, Richard. 3 really interesting presentations. I think quite a few synergies through that, but really interesting to hear about how e-cigarettes are being used in different settings and in different ways. And what we want to do is continue that conversation a little more before we go to our Q&A session. So we're going to try to have a breakout discussion and see how that goes. So this topic always has a range of views, and I think we can see that in the chat. There's a range of different positions on e-cigarettes. And so it may be that you end up in a group with people that have different views from you. And I think it's really important for us to all learn from each other and try to disagree disagreeably, to borrow somebody else's phrase. So I urge you to kind of participate in this conversation in a kind of a respectful way. So if we're just going to ask you to do a very short discussion before we all come back together. So first of all, if you can all introduce yourselves, and then we want you to explore some ideas about what you think the opportunities and challenges are around embedding vapes within our services. And if you have time, it'd be great for you to kind of reflect on some of the questions that you have for the panel. If you've also got some questions that you've already got, put them in the chat. Some are already there. We'll be having a look at them while you're in the breakout rooms. If I can ask the speakers not to join the breakout rooms, that would be great. And everybody else should be sent off now into a breakout room. And please, I think it will ask you to move and you have to click yes. And I think we'll be popping this little summary into the chat as well, so people can refer back to it. You will have to facilitate your own time, but there will be some prompts as well while you're in the breakout rooms. But right now I'm going to come to our panel and we're going to go through some of the questions that we've had already. First of all, Allan, I'm just going to ask you if you can give us any update on where we're at with the swap to stop scheme that was announced by the Minister about a month ago now, I think.
It was. Well, obviously, we've been very busy in that last month and we continue to be very busy. Unfortunately, I can't give you any specifics at this stage because we're still working on some of those. But what I can say is that we're hoping to have what we're terming as a pathfinder opportunity by the summer. So if there are any services that are seriously interested in being part of that first wave, that pathfinder opportunity, please let your OHID regional tobacco lead know in the first instance.
Is there any limitations on that, Allan? Is it local government that you're looking for as pathfinders? Because we've got quite a lot of NHS colleagues on here too.
It's primarily local government, primarily stop smoking services. But if you're eager and you're expressing an interest, that may be picked up in the next wave as well. So
don't let it hold you back. If you're interested, get in touch.
Not.
Thanks a lot. That's really good to know. Okay, let's go to a slightly broader question then, which probably bring all the panel in on. So there's been obviously quite a bit. I'm sure there was more conversation in the breakout rooms. Certainly there was some conversation in the chat about what we do and don't know about the harms from vaping and what the kind of long-term implications might be. And obviously this is a debate that's swirling around in all across public health and in all organisations. I'd be really interested to hear a bit more about how that debate kind of informed your approach within your organisations to using e-cigarettes, and how you perhaps myth busted some of the concerns that we know that are out there that are not necessarily grounded in evidence. Matt, if I could come to you first.
So probably there's two aspects to that. There's, from a clinical perspective, there is how we approach the disease of tobacco dependency. There was a process to try and develop the confidence and the competence, and vaping is just one part of that. But there is a whole education need across the clinical workforce to understand the basics around that nicotine is not a hazardous chemical, and it's not the source of harms of tobacco. That's a kind of golden, that's your source truth. That's really a piece of information we want all clinicians discussing with any patient that they meet that smokes, because everything comes from there. Then everything moves from that. All the treatments we have is both trying to address the very deeply ingrained habit of smoking through behavior change, and trying to provide the effects, creating the effects of nicotine, either by using alternative sources or medications that act in the same way as nicotine, just not getting it from tobacco. So that I think is the prelude to that discussion, because it's all built off there, and then it becomes very common sense that by not burning tobacco and creating the chemicals that do create the harm, it makes complete common sense that vaping is dramatically less harmful. And now we have just this wealth of evidence behind that. And I don't think it is a debate that it's substantially less harmful. Every international organization is behind that. It's substantially less harmful. And it's that, I think that's some of the crux of the conversation, is that no one's trying to say that there may not be harms, and it's difficult to quantify those completely accurately now, but it is very well understood that they are not they are substantially less of the harms that smoking is causing.
Yeah, and to bring in some of the data from the ASH survey this year, which we'll be publishing tomorrow, we have the most inaccurate views around the relative harms from vaping compared to smoking that we've ever had in our surveys for both adults and children. And that's obviously deeply concerning when you want adults to switch, but also from a young person point of view, if they don't understand that vaping is different from smoking and they've tried vaping, that's concerning as well. Just the person who's got their hand up, Viral, because we've got so many people, we're not going to take comments from the audience. If you've got a comment, if you could pop it in the chat, that would be great. Caitlin, I wonder if I could bring you in as well, because I know in the Northeast you've got this overarching statement that you were speaking to from the ADPH. If you could talk about perhaps how that's been useful in formulating your approach in the region.
Yeah, so there's the ADPH Northeast position statement, but there's also our tobacco task force position statement, which has been released just in the last month or so. And there's kind of 4 key points that is the aim of that statement, and it's about kind of collating the evidence that we know and making it kind of in an accessible format for basically anyone who will read it, predominantly I guess clinicians, and making sure that there's a clear message. But those 4 key points, the first one starts that smoking is the biggest avoidable killer, and I think it's about framing that vaping in that context. And then after that, highlighting that it's a fraction of the risk of smoking, as an effective stop smoking aid, and it promotes options and choice. And I think that's the key one for me, is being able to provide people who smoke with the information to make a choice. And if that choice for them is that they would prefer to vape, which is a fraction of the risk and harm, then we should be supporting that. And if we can provide that product the same way we can nicotine replacement therapy, even better.
Thanks, Caitlin. I'm going to move this on to talk about some more practical things, otherwise we'll run out of time. But thank you for those interesting contributions, Matt and Caitlin. So Richard, there's a few questions about how do you store these products, given that you brought it up. How do you store e-liquids? What are you doing to make sure that products are properly stored? What are the things that you're doing to take into account? Do you have any kind of feedback you can give people on the practical question of where do you put the boxes?
Yeah, of course. So initially we kind of had them in the office in a big range of cupboards, but that just wasn't practical. Eventually, they do produce quite a smell. So now we have a specific room in a separate office that we're able to store them in. But you do need to kind of keep an eye on them because some of them will not be as popular, and therefore we will need to kind of rotate stock and keep an eye on that. So there was a high level of stock control that you need to consider. But yes, word of warning, they definitely do produce a smell.
So you've got to find somewhere to put them. So
yes.
Put your point there around that there are some that people prefer more than others. There was a bit of conversation about the role of flavours in the chat as well, which I think would be useful to talk to. So what flavours have you made available to people, and what have you found people's approaches are to these different flavours and different products?
Yeah, so we have 4 different flavours. So we've got tobacco, menthol, strawberry macaroon, and pink berry, which is kind of like a mixed fruit one. Generally, I mean, previously actually we've provided kind of 2 separate tobacco flavours, and I would say that flavours are really important for adults who are looking to switch, make that change. And our experience has been that those that start on tobacco will very quickly go on to a fruit flavour eventually. It doesn't take them long, and it's that stock which we really need to keep an eye on to make sure it doesn't go out of date and is still usable, because people just don't continue with it for the whole 12 weeks.
Oh, very interesting. Does that chime with your experiences, Caitlin?
Yeah, I would echo that exactly. So we, because we do kind of direct from supplier, we offer slightly more. So we offer 10 flavours, but I did look whilst people were in the breakout rooms, and 25% of people opt for so like 25% of orders are menthol flavour, 25% blue raspberry, 9.5% tobacco, and the rest is made up of kind of the smaller amounts of other flavours. But yeah, same as what was mentioned previously, people who start on tobacco very quickly come back and say, oh, I don't like that flavour anymore, can I have something fruitier? So yeah, completely echo what's already been said.
It's interesting as well, sort of, there was obviously a lot of debate around flavours and their role in youth use, but it's important to keep that bit of context around how adult smokers are using them, and make sure we're listening to adult smokers at the same time as thinking about that issue around youth use. Matt, I wonder if I'll come back. I've got some more practical questions for you in a minute, Allan. Matt, thinking about, you were talking about the role of e-cigarettes in the kind of whole hospital approach and kind of keeping the hospital smoke free. And there was a question about whether you allow vaping inside. But could you expand a bit more on the way in which you think vaping has supported that smoke-free grounds agenda?
I think it's the key turning point in it. I think for many years perhaps we've paid lip service to a smoke-free NHS, where if you put a sign up around on the grounds, then we can say that we're a smoke-free institution. But actually, we have to be able to provide the mechanism and the access to the ways that you're going to overcome that dependency to nicotine, but they're simply using tobacco as the vehicle to get to that nicotine. And we need to provide alternative routes. For generally, if you're on a hospital ground, you're going through a difficult time when nicotine is a source of comfort and coping. And so you have to provide an alternative for that. And it has to be viable. It has to be a viable alternative that does substitute and creates the same experience and the things that person is looking for in the nicotine at that time. So it just feels like that vaping is finally the one that can be a substitute and can allow someone to be smoke-free in those moments. So it's been absolutely central to it. And so it's been through a process of trying to separate out vaping from smoking, because for a long time they got lumped together within a smoke-free policy, and changing the language, to that being a component of treatment for tobacco dependency, for a tobacco dependent person, not getting the conversation that be overrun by what if a teenager starts using it on the hospital grounds, and about that it is a component of treatment that will facilitate smoke-free grounds. The inside it's a really interesting question, and it is a bit one step at a time. It's a big effort to really overcome some of those quite tightly held beliefs and concerns about vaping, and try and really separate them out and make the conversation right and the language right about the ambitions of this and what it is doing and the reduction in harm from tobacco that it can help deliver. And maybe in the future, many other institutions, prisons, mental health trusts are far further forward in that thinking than acute care sites are. So currently for us, this is about external grounds, and there is definitely a real will to try and minimize the perceived social nuisance that vaping can cause and be counterproductive to what we're trying to achieve. So yeah, it's the external grounds, but this is a journey about how we understand how best to implement this now important tool in this battle.
I think that point around empathy with smokers and what they're going through on hospital sites is a really important one. I'm reminded of going in for a maternity appointment when I was pregnant and seeing a woman in very visibly in active labour being kind of supported out of the building to have a cigarette. And you just, an alternative for that woman would have been really great. Allan, one last quick question before we go into our final bit. Do these products through the portal, is it just direct supply or are there other options?
Primarily direct supply, because we've got a catalogue of products which you can go on and just order, but you are encouraged to actually talk directly to the vape suppliers as well to see what's best for your needs. So what's on there is just an example products. So that could, but you can also test them. So we are experiencing people exploring with them about doing voucher schemes, for example, and call off orders as well. So you can do a big supply, but you can have them delivered in separate chunks, call them off, or you can just order small amounts as you go as well, because that's what the platform allows. But it's really interesting that they're now starting to explore voucher schemes as well. And so direct supply to client with that voucher scheme.
Fantastic. So many questions. I can see so many questions coming through in the chat. We definitely have not had time to answer them all. We'll have a look at them all and see what we can respond to outside of this meeting. So I think we've got one last Mentimeter. Is that right, team? Have I got that right?
You do. You've got it absolutely right.
Something needs to come up on the screen, I think, in order for people to be able to do it. Right. As per before, follow the link or use the QR code. So it's www.menti.com, and then the code is 36385188, and Olivia has popped that in the chat there too. And we've got a couple of questions. Oh, it's disappeared. It's in the chat though. It's in the chat, everybody. Right. So we're gonna get you to give us a bit of feedback about today, and not all the results will come up, but it's better that it saves you having to fill in one of these SurveyMonkey surveys that we send out afterwards, and helps us to understand how to do these webinars better in the future. But I think there is one that will appear. So we're interested to hear about the action that that you will be taking. That will come up on the screen. I don't think this one does necessarily. So if you can fill this in, we won't necessarily see what we will see it afterwards, but I don't think everybody else will. So we're interested to know what stood out for you from today's event. Oh, we do get to see it all. Oh, my notes lied to me. There we go. Fantastic. Oh, I'm glad to see that a few people are finding the breakout rooms useful. A bit of an experiment for us. So glad that that was a good, amazing panel of speakers. Couldn't agree more. Great to hear about like a procurement platform. Lots of people finding that useful. Interesting. Good. Some good stuff for the breakout rooms. Excellent. We'll do those again. If you hated them, also tell us. Perhaps you can. Plus, I'll have a non-breakout room for those who don't want to do it. Okay, are we moving people on to the next question, team? So, what action will you take following today's event? Lots of discussions planned on the board agenda. Brilliant. Yeah, keeping up to date, always a challenge with this area. And there's some local plans in, right, people poised to press the button on buying some vapes, so checking what flavour and strength they need to go to. Over to the NCSCT, obviously, loads and loads of useful stuff around working with vape shops, supporting people with vapes, lots and lots of useful stuff on the NCSCT website. Exploring the procurement platform, have really loads of really interesting ideas there. Right, we've got one last question before I'm sure we all need to head off to our whatever is coming for the rest of the day. So this, I didn't think you were going to be able to see any of these answers, but this may or may not show what you found the most useful things were. But tap away and give us your answer. Is it sort of suggesting that the voting is? You might have to tap C to open the voting, John. Here we go. Maybe people can vote now. Our case study 1, to remind you, was Caitlin. I'd forgotten. And then we had Matt talking about Greater Manchester, and then we had Richard talking about Northamptonshire. So give people a chance to respond to that. Thank you so much to everybody. The voting should be open now. It was previously.
I don't think this one's just for us, Hazel. I don't think we're going to show.
I know, but I don't think people are saying they're not able to vote though, John. So I don't know. Okay.
Yeah, I think they might just need to refresh their screens, or
yeah, you might need to refresh your screens because it wasn't open when we clicked on the screen. But obviously we're really keen to get your feedback on this one. I can see some people are now managing to hit because the total is going up on the side of the screen there. Just as we close, thank you so much to all the speakers. It was a really, really interesting event. Thank you for bearing with us as we experiment with technology. Do add to your thoughts about how we can improve our events in the future. Always keen to learn. And we'll pick up some of the specifics from the chat with individuals. And a couple of you have messaged me directly. I'll also respond to you, although probably not on Zoom. I'll look out your email address. Looking forward to having some more events on this topic in the future. So thank you for your time today, everybody, and see you again soon.